Hi, I'm Dr. Bevin Campbell, and today I'm speaking with Dr. Richard Shulman as part of a series of conversations produced by the Psychotherapy Action Network, a global community of mental health professionals and stakeholders dedicated to promoting psychotherapies of depth, insight, and relationship. In this series, we're going to be speaking to authors, researchers, academics, and policymakers, many of whom serve as advisors to the Psychotherapy Action Network, and all of whom are concerned about the current state of mental health care policies and practices. We're going to be hearing what some important voices in our field have to say about the future of psychotherapy. As I said, today I'm very happy to be speaking with Dr. Richard Shulman, who is both one of the founders and the ongoing director of Volunteers in Psychotherapy, a nonprofit organization that allows anyone to earn strictly private psychotherapy in exchange for volunteer work they provide, independently and privately, to the charity or government agency of their choice. Dr. Shulman is a licensed clinical psychologist who previously worked at Hartford Hospital Institute of Living, where he provided psychotherapy and supervised and trained psychologists and other therapists. He also served for 20 years on the hospital's Institutional Review Board. Additionally, Dr. Shulman is on the steering committee for the Psychotherapy Action Network. Thank you so much for joining us today, Rich. And I just wanted to start, can you tell me a little bit about the history of volunteers in psychotherapy and how it came into being?
Sure. Although there are probably a couple of different ways of telling the history, but one way of looking at it is I had some psychologist friends who I was close to and really admired and respected. And we used to get together all the time and complain. We'd talk about what great training we had and how interesting it was to talk with people in therapy, what amazing conversations they were, how helpful they were to people, all the subtle hints that were interesting to try and pick up on about what was troubling someone, how to talk about very difficult topics with people. But the flip side of the conversation was how problematic the institutions that we worked with were and how they interfered in some ways with doing good psychotherapy. That's one way of telling it. Of telling the story of VIP, because I was working in a poor person's clinic, seeing people who had been in and out of state hospitals, in and out of emergency rooms, people with no funds really. This was also the age of managed care. And at that time, by coincidence, one summer, I had two different women come to me for first appointments, intake appointments at the clinic. And both of them right away said, "You're a psychologist. I want to talk about, I was sexually abused as a kid, and I know it's messed me up. I know it's affecting how I live my life." But their third-party payer wouldn't pay for them to have therapy. Third-party payers in general insist that reports be sent out periodically. They can demand that you give a psychiatric label to people, which can be highly misleading and problematic, and in some ways sort of goes against accurate, informed consent. And we thought we could set up a much better system. And there was this idea floating around in psychotherapy lore that I had some great students that I went through graduate school with. And in fact, two women who were very experienced therapists and came back to do a doctorate, even though they'd already been practicing for years. And in psychotherapy lore, you heard the idea of somebody working with someone. Let's say a client lost their job or lost their insurance. And even though the therapist used to get paid, let's say $100 per session, the therapist might say to the client, "I tell you what, if you can pay me 20 bucks, I'll keep seeing you, but I'll ask you to do some volunteer work in the community as a way of sort of contributing to your therapy." And I was working at a poor person's clinic where there were many aspects of what was going on that weren't looked at. For instance, that people who had had difficulty in their life were viewed and encouraged to take disability, even though they might hint at the fact that under the table they were doing landscaping to make some money, or they were tuning up cars, or they were even trading stocks. And many of these people would no show all the time for appointments. They weren't motivated to come in, but they were sort of in a problematic situation where they were getting a disability check that gave them a subsistence lifestyle. And so some of the people, of course, were very motivated coming in to talk about difficult things that were troubling them, that were hard to figure out in their lives. But ultimately, these friends of mine and I thought we could set up a much better system if we simply made it be that essentially people retained all of their civil liberties, our clients. This was not a probationary relationship. And in fact, we signed an agreement with all our clients saying, that if we work with you through VIP, we will not talk to anyone about you, won't write to anyone about you, won't do any evaluations. So then therapy only is bounded and becomes only about whatever personal questions a person is struggling with. Somebody can't use therapy to get out of a legal problem. They can't use therapy to get funds to be seen as disabled. And we set up this nonprofit organization, which isn't that difficult to do, but it takes some effort. And essentially, we reified this idea of people paying for therapy by doing good work in the community. So as you mentioned, all of our clients pick where they want to volunteer, as long as it's a bona fide nonprofit or charity, which means it's overseen like we are by the IRS to make sure that there's nothing untoward going on and that the funds are going towards some community service. And it can be a government agency like a public school, public library, a VA hospice or something like that. And so people arrange their volunteer work completely independently. So there's no stigma. Nobody knows that they're doing it to earn their therapy through us. They get documentation of it indirectly from the organization. In other words, if somebody's volunteering at a local soup kitchen, they may take a picture with their phone, or they may Xerox a copy of the sign-in and the sign-out sheet, or if they're sleeping overnight to help out a shelter and help run a shelter, they may get a schedule which they show us. So they get us documentation that they arrange without the agency knowing that they're in therapy. And basically, it's a nice little system because you really have privacy, and our clients know that they're in control of what I like to call the gas and the brake. If they're approaching really difficult conversations about things that scare them about themselves, ways in which they're frightened about things that have happened in their life, they know it's sort of the old-fashioned model of a very bounded psychotherapy, which is in a way our connection with PsiAN, even though it came up more indirectly. But we are big proponents. This really came out of wanting to do good old-fashioned private psychotherapy where the client was, in a sense, symbolically paying for their therapy, and they were in control of whether it continued, how much, etc., instead of an insurance company that profits by limiting people's access to psychotherapy and demands reports and these other problems that I alluded to.
Right. Well,
That's a pretty long answer for one question.
Well, it's very helpful. You are pointing out, one of the things that I read about volunteers in psychotherapy is that, as you said, part of the goal is to address, I mean, I know, many people I work with, their starting point for finding a therapist is to go to their, medical insurance and look at the panel and try and find someone that way. And it sounds like the organization is really coming from a sense of seeing significant problems with that model, that framework of having therapy. And you talked about some of them. Privacy, it sounds like, being one of the main ones you've had on your mind.
Right. And through VIP, we have the freedom to sort of work in the way that we think is best. And it relates to what you were just saying, that if you give people space and absolute privacy and let them just talk, they'll tell all sorts of stories that indirectly hint at different threads, so to speak, in what is troubling them. And then you have really meaningful conversations with them, often talking about things that they couldn't talk about somewhere else. And there's great relief if they unwittingly are hinting at some type of troubles. And many times it's the type of trauma and human difficulties that you were just referring to. And that's why VIP is a nice little system. It's not like it's necessarily the panacea for everybody, but in terms of offering therapy, it sort of protects, makes a haven for those types of discussions. And often that is what's motivating people to come in. They know that there's something that they can't quite see that's tangled up inside them, and it's very humanly understandable. And that even goes back to what I was saying about those friends of mine who helped found VIP, because we'd compare notes about the complex sort of work of trying to decipher what somebody might be getting at about what it is that's eating at them or confusing them, etc.
I wanted to ask a question about the idea of volunteer work being the way that someone pays for therapy. And first of all, I love the way you came to that. It almost sounded like it was an urban legend, like a psychotherapeutic urban legend that you guys wanted to bring to life. But one question I have about it is like for yourself or amongst the founders of the organization, how do you think about the volunteer work? Do you conceptualize it as part of the therapeutic process? Is it a separate entity altogether?
Well, I guess it'd be different for every client. And just to give some examples, we had a client who had significant childhood medical difficulties and chose to volunteer at a children's medical center. And sometimes people pick something that's very meaningful to them. We did set it up as a way of implying to people that this was an exchange, sort of an egalitarian relationship between us and them in terms of discussing things, but that they were hiring us and they were paying for it by helping out other people in the community. And it was meant to sort of remind people that everybody has something to give, and that everyone can do meaningful work, and that people get the sort of rewards that come from volunteering, a sense of purpose, a sense of doing some good that helps out other people. There's also a nice parallel that while they may be coming to us with things that they want help with, they're clearly helping out people in the community who are benefiting from it. So in some ways, it sort of undermines any authoritarian elements of psychotherapy, and instead makes it very egalitarian. And it clearly says that there's like a fair exchange through VIP in which everybody sacrifices to some extent. The therapists don't get paid top dollar, although one of the most interesting things is over the years it's come up repeatedly, not from every client, but that clients have been reassured to find out that their therapist is paid something, and that this isn't just a sort of a personal charity going on. But I guess, what I think you're implying, yeah, it was meant to say that everybody could get the benefits of volunteering. People, they rub elbows with others in the community who are doing good works. They see their efficacy in the world, and especially for people who question that in themselves, that can be a really important thing.
Right. I mean, I've definitely seen those benefits in people that I've worked with who have sought out volunteering, and especially, people who are isolated, and, to be able to connect it socially, to connect to your community. Have you found it to be different in any way, like the experience of volunteering for people? Have you gotten any reports on this, versus someone who goes out on their own and pursues volunteering, as opposed to someone who's using it as part of this exchange?
I wouldn't say it's one of the things that I focus on or that I know about so much, although I'd point out that somebody did their psychology doctorate, their dissertation on that very subject some years back. They contacted us and we set up a whole way of anonymously allowing clients who wanted to participate. And that was one of the central questions that they asked. So how does it feel to volunteer, but to do it in exchange for therapy? And I think for most people, whatever it is that is most burdening them is the central thing. They may have some reactions to their volunteer work, but the key questions on their mind that sort of impel them to come and speak to us is actually this sort of takes center stage most of the time.
Right, that makes sense. So I'm currently working with a group of people who are interested in starting a community mental health clinic, one that ideally would address issues of equity and access to services. And this group, we're trying to do something new, something novel. And just so far in the process, I've found that it is, really, even at this beginning stage, it's really complicated trying to approach things in a new way, to do something novel in the field of community mental health. And I was curious, how it has been for you, the development of this organization, bumps perhaps you've encountered along the way, or challenges or things that have surprised you, because this is, in reading about VIP, it's very new. It's a new way of approaching the problems of how do we connect people to meaningful psychotherapy.
Sure. But on the other hand, we've been doing this for almost 22 years now. And before we did it, we did a little pilot study of, was this feasible? That is, we didn't set up the nonprofit structure, the therapist wasn't paid, but in fact, it hasn't been very difficult. This has been quite doable. And I think in part because the psychologists we founded it had a pretty clear idea of what we wanted to both develop and avoid. And also, it helps that we had resources and close personal relationships with people who knew their way around the nonprofit world. Although it's not rocket science, it's, and in fact, the most surprising thing, when actually it hasn't come up in years because we've been doing this for so long, but waiting for a lawyer to set up our nonprofit status, that was the biggest bump, and it was probably an unwise move. It's so simple to set one up that we probably shouldn't have been as cautious as we were in setting up the nonprofit application to the IRS. And like I said, the biggest surprise I think of is the one about clients. Always, it's just consistently they're reassured to find out that we do pay the therapists. Well, I'll tell you a vignette about that. I was in a nonprofit training at one point, and a board member of mine was there, and he asked a question of the speaker, and the speaker said, "Well, could you clarify what your nonprofit does?" And the board member, who was relatively new, said, "Rich, would you explain it?" And there were about 150 people in the room, all heads of nonprofit organizations getting this training. And I briefly explained it, and there was this audible that went through the room, like, what a great idea, have people do volunteer work, and so I think most of the time people hear it, they sort of, there's this old term, grok it. They get like the idea of like, what a nice idea. And there are models of charity even that say the best way to do charity is to get people to work, to help people become independent and autonomous and feeling good about themselves. So largely it's been pretty positive, and you may have run into, we've had feature articles written in the New York Times and in Psychology Today and in the APA Monitor. So we're very small, but sometimes when people hear about it, they like the idea, and it's a nice little system for psychotherapy. And in fact, we've suggested at times that places like graduate training programs, I don't know about your graduate school, but mine ran a clinic so that we could get training in supervision by our professors, by our faculty. And typically clients who came in paid nothing for the therapy, but we'd suggest, well, why not do something like this where people pay something and contribute something? They're getting something in exchange, so why not ask them to do something? And it's not barter because they're doing it to help other people in the community. And there are also other, I think, creative adaptations of this that could be used. For instance, years ago, there was a well-known analytic hospital in the DC area called Chestnut Lodge. And they had lots of very well-known psychiatrists and psychoanalysts, psychologists who worked with really severely troubled people. And the hospital was going out of business. And one of the regrets of many of the people working there was that they weren't going to be able to pass on this knowledge about how accessible for even people who get severe sounding diagnoses, how helpful psychotherapy can be for them. So we were brainstorming with them about a slightly different model in which therapists provided therapy to really disturbed folks who might typically have gone to Chestnut Lodge, and they provide the therapy for free, but they get free supervision from these extremely experienced analysts as a way of sort of doing something a bit similar, but in the same spirit. So I think there are a lot of adaptations that could be made of this sort of approach.
And it sounds like you through the export initiative that VIP has, you've been helping with that, helping people, adapt the model to different circumstances or to try it in different communities, which is really amazing.
Right. And to be clear, it's not that we want to franchise it. We don't want to have control if somebody in Kansas City sets up something like this. It's just we would help them not have to recreate the wheel, or help them, consult with them, to think through things about nonprofit status or functioning, or how they might set up a program. And frankly, when we got some of our biggest publicity over the years, it would elicit lots of contacts with therapists in different places asking about, could I borrow from this model? And there were times when I totaled them up at one point. We did about 100 one-hour consultations with therapists all over the country. Wow. And and there had been some places that set up programs like this, but we were lucky in having several people, and now of course a board of directors that makes this work. But most of these other places, I was actually interviewed recently for another article about VIP, and the person asked me about this, about other organizations nationwide that have borrowed from our model. And from what I can tell, most of them have stopped functioning. They functioned for a few years and then didn't, for whatever reason, couldn't keep it going, but which is a shame, because it hasn't been that difficult for us to do. And we really, if people are excited about some variation, some adaptation of what we're doing, it would be easy for us to consult with folks to help them come up with something that would suit their circumstances, their resources, and what they wanted to implement.
So you've really had staying power, you're pointing out. Yeah.
In fact, in our newsletter a couple of years ago, we pointed out that, I don't know if you know who Joanne Greenberg is. She's the woman who wrote I Never Promised You a Rose Garden. And it was really the fictionalized version of her inpatient hospitalization and therapy with Frieda Fromm-Reichmann.
Right.
So she's on our advisory board, as well as Bert Karen, who is the head of the Division of Psychoanalysis and APA. And both of them are on our had been on our advisory board for years, and they would talk up VIP, and they similarly got responses from people saying, "Oh, that's a nice pipe dream, but that could never work." And they said, no, this has been functioning for 20 years now. Anyway.
Do you think that when we talk about, different ways it's been adapted in different places that have tried this, do you personally feel that this model has potential in a larger scale to address issues of people accessing meaningful private therapy?
Absolutely, because the whole structure of it is meant to give people the ideal psychotherapy experience with them being in control and them having privacy. One of the problems of a managed care approach, or even in many public clinics, is there's always money pressure. And therefore, they want to limit people's access to therapy. Whereas, our clients are doing significant amounts of work to earn our therapy, so they ration it themselves. And we are a nonprofit whose whole sole function is to provide therapy and to try and set up a system of exchange that makes it cost something reasonable, in people's times. But to give, if somebody feels that they need to speak to us hours a week in order, that strengthens them, and if they're willing to do this good work in the community to earn it, then by all means, as long as it's a constructive pairing between the VIP therapist and the client, it's not subject to, say, governmental pressures to give people medication and not access to therapy because it'll cost the payer too much. And, that's, in the meetings that I go to through PsiAN, I count my lucky stars, because so much of the energy of the group that I'm part of, the steering committee, goes into how much they struggle with the third-party payers, because it's a monopsony and they control the money and they control so many of the strings about how therapy is done. So I definitely think that setting up something like this, and it's kind of tripartite. The third part of it is that because we're a nonprofit, we can apply to, say, local family foundations. And these are typically set up by families that became wealthy and thought, this is more money than I know what to do with. Let me plow it back into the community and support charitable and nonprofit organizations that are doing good work. And here in Greater Hartford, we've almost never had national type funding. It's mostly been these small family foundations, and we get $2,000 a grant, $3,000, $8,000, $10,000 maybe. And they know that we pay therapists $55 a session. If that's been for about 12 years, for the first 10 years, we paid therapists $45. And so everybody really is contributing to the common good and sacrificing a bit. And we get, of course, individual donors and make tax deductible contributions to us. And so it's this tripartite system that insulates the client, where they are in charge, or the people who fund us, whether it's grantors or individual donors, recognize that this is a good system, and they're sort of saying if it's worth it to an individual to do 4 hours of volunteer work, helping out other people in the community, then I'm happy to subsidize their therapy essentially, because that's our big expense, just to pay those therapists the $55 a session. And let me mention the core of our therapists. And by the way, I work full-time through VIP. I helped found it, but the other folks are all typically private practitioners who understand why we're doing this and want to get involved in a way. They want to contribute to the community through this. The core of us, I think 4 of us, all have 35 years experience by coincidence. So it's people who were trained before there was pressure to do managed care work and to see things through that lens and not to look at the bigger picture of how problematic it could be. And we also have a social worker who is trained at Smith, which is an excellent social work program in terms of actually teaching psychotherapy. So we're lucky we have people who really understand why it's important to set up therapy in this way.
Yeah, what you just said made me think that, you know, my experience is that for people in private practice now, I mean, there isn't a way around managed care. You know, even if you say, I'm not going to take any insurance, I'm not going to participate in panels, many of your clients will want to access their benefits, and then that can get you into something that sounds like patients who or clients who are part of Volunteers in Psychotherapy don't have to do, or their therapists don't have to do, which is, you know, justify the treatment, justify the ongoing treatment, try to defend the work and why it's important for this person on a continual basis. And I do think, you know, when you're in private practice, it's almost like it becomes a part of what you have to grapple with, even if you don't want to.
And in case somebody listening to this tape doesn't understand, you're talking about justifying it so it could be paid for by the insurance company. That is, the insurance company is constantly fighting you and saying, well, why should this person continue? That is the real tragedy of how things are now. And it's important, I think, to step back and look at what a bad system that is, because in part, they're requiring you to give up information about the client. You know, you get put in this difficult conflict of interest where if somebody is talking to you about horrible sexual abuse they talked about, do they want it reported to their insurance company? Does the client even understand that there's this difficult negotiation going on? And, you know, we're lucky we set this up, and it's a decent system for dealing with some of these problems. And there are trade-offs, but we're happy to make some of those trade-offs.
I wanted to ask, do you have a vision for the organization, or something that you see in its future, or a direction you see it heading? Or do you imagine you're going to keep, you know, doing the work that you've been doing?
I think it's mostly the latter. We just enjoy doing the work in this way. We'd love it if other people benefited from this. Either, you know, I'm a big proponent of, I don't know if you've ever been to the website Mad in America, which contains many criticisms of the mental health system. And it's both liberating and horrific to hear what many people have gone through in the mental health system. And if people who suffered with that instead had resources like VIP, I think they'd be happy. And I think therapists, you know, they're in a difficult position. You know, you go through all this training and then come out and then have to deal with the constraints that you were just talking about, where really so many, the dominant system is that insurance pays for people to be in therapy. And then there are all these binds that come up. So, you know, we do think one way out would be for people to consider setting up something that borrows from some elements of this. And a nonprofit structure is meant to provide services to the community, and it can be a way for people, even if they don't, you know, borrow exactly what we do, to set up something which restores important aspects of therapy and allows people to talk about things that are so hard to talk about at first in therapy.
Right. So, Rich, I wanted to ask how you got involved with the Psychotherapy Action Network.
Well, it was just a coincidence. In fact, we talked about Bert Karen, who is this really beloved. he was on our advisory board. He was the head of the APA division of psychoanalysis. He was a professor at Michigan State University. I came to know him because he wrote a terrific book called Psychotherapy of Schizophrenia. And it was a big interest of mine when I was working at the previous hospital. And Bert died about a year and a half ago. And suddenly we got a nice small donation from some organization in Michigan, and I'd never heard of it. And when I Googled it to try and find out something, I saw that they were listed as being one of the constituent organizations of PsiAN. And when I read about PsiAN, I thought anything that promotes psychotherapy's depth, insight, and relationship, well, that's why we set up BIP. So that was actually the initial connection there.
That's great. Well, you've sort of alluded to this throughout the time we've spoken, but I did want to ask about your own personal or professional experiences that contributed to your, and you obviously really have a belief in the value of and the power of psychotherapies of depth, insight, and relationship. So I wondered if you could say a bit about that.
Well, I was lucky to have good, I went to a small graduate program. I mentioned those two classmates of mine, and we also had a couple of really good supervisors and trainers, the faculty, and that got me interested in, I don't know if you're familiar with Harold Searles, an analyst who wrote a terrific paper, amongst others, called The Patient as Therapist to His Analyst, suggesting that we as therapists should listen to the stories that our clients tell, because they may be supplying criticism and reaction to things that we are saying. And then there's Robert Langs, Langs, the analyst in New York City, who for a few decades wrote up voluminous descriptions of his residents, his psychotherapy residents, their supervision of the therapies that they were doing with people. And it's very similar. I mean, he called it derivative commentary, and it's the idea that the seemingly innocuous and perhaps seemingly irrelevant stories that people tell you in therapy may have all sorts of unwitting commentary about what's going on between you and the client. And like I said, I was working in a poor person's clinic for years. It was actually where I did my internship as part of a consortium. And I came to find out that these people we called psychotic and schizophrenic were often people who were talking about horrible, horrible trauma that they had sustained in their life, and it was secret. And one major route into it was listening in the way that Searles and Langs suggest. And luckily that one of my supervisors in particular in grad school emphasized. So those were the reasons that I became very enamored of this. It just repeatedly proved to me to be telling and informative, to sort of do supervision by thinking through what the client was talking to me about and how it might relate to subtle aspects of things I was doing and saying in our relationship. And it's just, to me, in an empirical way, in the best use of the term empirical, it proved to me the importance of this type of work in therapy. Just they can be such liberating conversations for people who have been confused about aspects of their emotional lives or their reaction to difficulties in their lives.
Yeah. Well, I want to thank you so much for speaking with me today. It's been really great. And
Sure.
I want to also say people who are interested in Volunteers in Psychotherapy can go to ctvip.org. Thank you everyone for watching. The Psychotherapy Action Network is a 100% volunteer-run nonprofit, and you can learn more about our work at PsiAN.org.